Congratulations, got them built up. I know this is a challenging procedure. Again, I'm going to emphasize that last layer, that enamel layer, whether you're using a nanofill or a microfill composite for your enamel layer, get it nice and smooth as you can. If you'd like to use brushes, then use a brush wetting material to help you with brushing the material. Personally, I like a clean titanium coated instrument, using it like an artist brush though to get nice smooth strokes. All right, once it's finally cured, let's go back. We're going to start out, first thing we're going to do is we're going to torque between the teeth. Again, caution your patient, you're going to feel a little click. This can be a little scary for dentists who've never built up composite next to a neighboring composite, and it certainly was for me. But as long as you have polished that first composite surface, this new composite can't bond to it. Composite cannot bond to a polished surface, so whether it be porcelain or composite or gold or unetched enamel, we can build right to it. Understand it's going to be a tight contact, it's going to be stuck, but it's not bonded. So let's go ahead and do our torque, and then we're going to start cleaning up, and then we're going to start doing the first initial contouring steps. So let's take a look. All right, first thing I'm going to do is I'm going to take that same instrument that I used earlier. I'm going to come in between the teeth, and I'm just going to give a little pull away, just a little torque to separate the teeth. Again, that's kind of scary, but just caution the patient, that's what's going on. Okay, once I've gone through the contact, now I'm going to use a fine diamond strip against the tooth that I just did the new bonding. So I'll introduce the strip. Oftentimes it's such a tight contact that my assistant will have to come in and do a little torquing between the teeth so I can get the strip in, and I want to just very lightly, very gently run my strip in through that contact. I'm going to do a final polish of the contact after I finish my contouring. Now, before I start the contouring, I want to identify where the height of contour is for my line angle, as we talked about during the presentation. So in this case, I'm going to sort of draw where I want my line angles to be. So I see on my right central incisor and my left central incisor, I want to mimic that. So I'm going to start blending the composite in, avoiding going past that line angle because I want to keep this in a zone where I'm going to be polishing back in here and then in a separate step polishing into that line angle. So just using my disc to trim that back. To do the contouring, I could use one of two instruments. I could use a carbide burr like the ET9 burr from Brasseler. That works really well when I'm working on enamel. It's a little bit harder on these plastic teeth, so what I prefer to do is use a second technique where I use my contouring disc. With a contouring disc, I want to get pressure on the disc and I want to go from composite onto unprepared tooth structure, etched but unprepared tooth structure. You're going to see a white line where the composite dust is filling in where the composite is not intimately smooth with the tooth surface. So we're going to keep working over top of that line until that line disappears. Once that line disappears, then I have the composite so intimately smooth to the tooth surface that there's no place for the composite dust to settle. So I'm done contouring in that zone. I'll have to go back and polish that, but I want to avoid contouring anymore because I've already eliminated that line. And then we're just going to be working on the facial contouring and the interproximal contouring before we start doing the facial polishing. All right, so let's do that next. To begin my coarse contouring, I'm going to use a medium size coarse disc. The disc is away from, or the cutting surface of the disc is away from the handpiece, and I'm going to be moving the disc from composite onto tooth surface, running the disc at around 3,000 to 4,000 RPM. You can see there's a slight flex to the disc. And I'm looking for that white line where the composite ends and the composite dust is settling. You can see a little pit right here that I'm working on. I'm going to zoom in a little bit. You'll notice as I'm working my disc, I'm not lifting the disc off the tooth surface. I'm rotating it around see this little spot right here. And that's how we blend that composite onto the facial surface to make a seamless margin. When you're doing the contouring, I want you to be looking from the incisal. Again, as we talked about during the presentation, we're looking for the contact, the proximal contact, to be towards the palatal, so we can de-emphasize the facial sides, because we're going to be bringing in these facial contours so we can prevent having the tooth look too wide. So as you're working with your contouring disc, if you see this white line right here, you might need to get a new clean disc. And running this disc again around maybe 4,000 to 5,000 RPM until you get that line to disappear. We want to do the same thing on the neighboring central, on the other central incisor. Again, looking from the incisal as we're looking at the contour to make sure that our contours are similar. Running from composite to etch but unprepared tooth structure. If you look from the incisal, you can see I have a little bit of bulk in this zone here on the facial, so I want to use that coarse disc to come and remove some of that bulk to get it to mimic more what I have on the right central incisor. My disc is starting to fill up with grit, so I'm going to switch off. Start with a clean disc. And we'll continue on to get it to mimic the facial surface of the corresponding central. I will also use the coarse disc to smooth off the incisal edge. When you're adjusting the incisal edge, your disc should not be at 90 degrees, but more at a 45-degree taper coming from lingual to facial. Let me show you on a different angle. So we don't want to adjust at a 90-degree angle. We want to be coming at a 45-degree angle to allow the lower incisal edges to roll over that edge. Okay, work on your facial contour. Eliminate that line where the composite is ending and then blending onto the tooth structure by using that coarse disc. Get a little flex and press, running your disc around 4,000 to 5,000 RPM, getting a little bit of pressure on there, running from composite to tooth structure. Once you get that line eliminated, then you're done working in that area, and then start looking at the other areas to contour to get those two teeth to mimic, staying inside of that line angle that you drew with your pencil, because we're going to work on the contour going into the proximal next. Okay, see you at the next module.